Curious about how pediatric care and family wellness are being revolutionized? Meet Dr. Meaghan Andre-Brown, a visionary pediatrician and lifestyle medicine expert, transforming how families approach health. As the founder of Empowering Pediatric Wellness, Dr. Meaghan combines her extensive medical expertise with a compassionate, holistic approach to support children's physical, mental, and emotional well-being. Her groundbreaking model of direct primary care, or DPC, ensures that families receive personalized, accessible healthcare without the limits of traditional insurance. Beyond her innovative practice, Dr. Meaghan is a passionate advocate for preventative care and lifestyle medicine, empowering families and practical guidance on nutrition, sleep, activity, and stress management. Today, she joins us to share her insights on reshaping pediatric healthcare and the incredible benefits of DPC for families. And join us in welcoming Dr. Meaghan Andre-Brown, a trailblazer in modern family medicine. That's cool. Yeah, I appreciate you coming on the show. We met at a chamber event and you started describing what you did, and I thought it was really cool because a couple years ago, my wife and I went on to take on a concierge doctor with some of the reasons I think you're doing what you're doing. So I'd be interested in you kind of explaining like what this is and how it's different. I mean, anybody's had children has had the whole experience with a pediatric doctor. I mean, some good, some bad, some whatever, right? All blended styles and stuff like that. So kind of give us an idea of what it is and why you're doing it this way as opposed to what most people are experiencing right now.
Yeah, sure. So thanks for having me. This is really exciting. So I decided to do this model just because I felt like traditional medicine was doing a disservice to a lot of families in terms of just not getting enough quality care with their pediatrician, just not enough time, not enough guidance. And I felt it was a little bit frustrating just as a doctor myself, just seeing patients 15 minutes and then that's kind of it and all that we have. So in this model, it's different where we can actually spend time. So my patients were able to talk about, anything that comes up in terms of parenting. If they have any concerns there, we can really focus on a lot of lifestyle, prevention, nutrition, physical activity, mental health, all of that. So I really felt like this was a need for families just to be able to have a trusted advisor along their path of parenthood, because being a parent is hard. And sometimes we have so many questions and you just don't have enough time with your pediatrician to get all those questions answered. So this model allows me to develop relationships with families and really, focus on just prevention rather than just treating illnesses.
No, I agree 100%. I know. I'm thinking back. This is ways. I'm a little older. My children are grown, but especially as a young parent, I'm thinking back. Right, young parent. I just remember the delivery room. They came in and they handed us our son, and they're like, "Okay, here's your child," and we're kind of like. We kind of looked at each other like, okay, I guess we got to take care of this now, right? So we had this strange, excitement, but still we're like, oh, this is a huge responsibility, right? And then as time goes on, now you have to go in and find out there's a lot to know. Right. I remember my wife read this book, what to expect when expecting kind of thing, right? And then when you have the child, it's so how do you help kind of these young parents? Because I know you're kind of thrown into this. You really just talk to friends that maybe had children, and that's really about it. I mean, there's really not a whole lot of, and as you point out, when you go to the doctor, they're really just, kind of taking the temperature, making sure the child's healthy, and the child's good, go.
Right.
But that's kind of it. You're not really given any guidance on all the other things that you tend to learn on I call it the experimental child, which was our first child. You try everything on them and you figure out what works. If you have multiple children, you go, well, we won't do that one again because it didn't work on the first one, right? So
yeah, for sure. So I mean, there's no guidebook on how to parent, and there's different ways of doing things too.
Right.
But really, with my approach, I offer like a newborn package where, families, I meet them beforehand. We kind of go over things, what to expect, how to change a diaper.
Right.
And,
Yeah, simple stuff, exactly.
Those things that you don't know or nobody teaches you, right?
Correct.
And then through the whole like fourth trimester up until like 3 months of age, you get me like weekly. We'll have like weekly visits or just like talks like, oh, hey, my child's doing this. Like, what do you think about this? Or, there's so many things when you bring home your newborn, like just like the sounds they make sometimes can be terrifying, right?
True.
So there's a lot of questions. And like you said, now in this day and age, there's also just so much information. So like social media and just Google in general. So I just feel like we're like bombarded, like new parents are bombarded with so much stuff, and they don't know which way to go sometimes. And having a pediatrician, the way I practice is like, okay, you can bounce ideas off of me. Like, oh, I saw this on Instagram, and what do you think about this? So I definitely allow for more guidance throughout the whole process, and not just newborn period, but even like every part of being a parent. So there's like, the toddler stage, there's obstacles. Being preschool, there's obstacles. You're always going to hit obstacles no matter like what age your child is.
Right.
So really like having that partner in this is really my goal of having my practice.
Well, I find one thing you mentioned I didn't even know is that you actually talk to the parents before the child comes to visit us in the real world, right?
Yes. So that's important.
That is interesting. I never heard of that, where you're giving them guidance, like near the end of the pregnancy, so they're like, "Oh, okay, we're getting closer and closer and closer." Whereas, at least my age group, there was no. They just got you to the delivery room, and then you're kind of like, "Good luck." When we think you could go, like this afternoon, you're on your way home, and you're literally just asking friends like what to do. So it's nice to have it, and you also mentioned there's a lot of information out there, but it's not necessarily applicable to your situation a lot of times, right?
Exactly.
And so that I think can be a little disconcerting, because you're going to hear especially as a new parent, you're going to hear things and see things.
Yeah.
And you're going to be like, oh, should I be worried about this? Is this a problem?
Right.
And a lot of things just might be the natural development of the child. And there's times where, maybe the noise or the things the child's doing could be a problem. Maybe it's just something normal, right? Like you don't have to worry about it. Just keep an eye and don't be concerned about it, right?
Right. Yeah. So there's a lot of new things. So I think just having, a pediatrician where you could just text or you can just call them is really valuable for these new parents, especially. Just, with any questions or concerns they might have.
Right. So are you, because I know with adults, it seems to be taking hold for sure. Right. Because of the people I work with and myself and everything. So, I mean, that's definitely taking hold. So are you seeing this as a new trend? I mean, how long has this kind of been around? Because I just learned about it when I met you. That's the first time. That was my first experience. So has it been something that's been around at some level for a long time, but now it's kind of taking hold, or is it relatively new, or kind of how did this develop as far as you were?
It's relatively new, I would say. But there have been pediatricians. I think the oldest pediatrician, like DPC practice like mine, is about 6 years old.
That's pretty young.
Yeah, is the longest one that I'm aware of.
Okay.
But there are lots of more that are popping up recently. So within the last 2 years, I feel like it's definitely kind of taking off. I've been seeing a lot more posts and people posting that they're opening their own practice. So yeah, it's definitely coming.
Do you think that did something, because you're talking about the time period, well, the 6-year-old, no. But did anything have to do with all the issues we dealt with when we were literally remote and you couldn't necessarily see your doctor unless it was in a particular case? And because 2 years ago, that's literally when we were kind of coming out of the whole COVID thing and the lockdowns and all that. So did people I'm trying to figure out what kind of alerted to people to maybe there's a better way to do things?
Yeah. I mean, I think that probably played a role.
Okay.
Because I think during COVID and all of that, the DPC were able to shift things a lot more quicker than traditional medicine, and they could. I mean, we do virtual visits, so it's not something unheard of. Or some of the pediatricians would do home visits, which, in traditional medicine, you don't do that.
No, that's definitely
So yeah, in
not
our
anymore.
model, we would be able to go to the house and see the patient if need be. So I do think there was a lot more flexibility for DPC practices. And I think now a lot of doctors are seeing the other side of,
Right.
being able to practice medicine the way we want to practice medicine in terms of providing quality care for patients, building relationships with families. I mean, I think a lot of, me as a pediatrician, I went into pediatrics because I loved the relationship building of being a pediatrician and seeing the child growing up from newborn all the way up to teenage years. And in traditional medicine, I mean, you don't get to make those relationships as much as I thought.
Right.
Which is why I feel like this model is so much more impactful.
Awesome. Yeah. Okay, now that you've gone through and you kind of did an analysis, like from the patient standpoint, obviously, so there seems to be more of a demand. But the other thing that I think I noticed, at least from what I'm reading and talking to people, is that you touched on how the quality of life for the doctor has changed, right? And I think I'm seeing a lot of doctors literally left their practice because they're like, look, I'm burnout. I can't do this anymore. You have this cost compression thing going on with reimbursements, and they're spending a lot of time dealing with insurance companies and things like that.
Yeah.
And less time with the patients, and that's not really why most people get into medicine. I'm assuming
Right.
they want to take care of the patients.
Yeah.
So does this allow you? Is it easier as far as how your reimbursements are? Because the one I have actually kind of does a blend. Like certain things I'm paying directly, but they do reimbursements too. And I know there's other levels where it's just you just pay for everything, right? So it depends on what you want to do. There's all kinds of like models out there.
Yeah.
So how does this one work?
There are different type of models. Mine, I don't take insurance at all.
Okay.
So it's a flat monthly fee or a flat yearly fee.
Okay.
And then everything is included in that fee. So unlimited visits. So all your sick visits, all the well child visits, depending on their age. And then like texts, calls, video, televisits. I do offer home visits for the newborn period, and then after that is for a fee.
Right.
But the only thing that I would take insurance would be for like vaccines, for lab work, or any imaging, or need be they have to go to the hospital, then they would use their insurance.
Okay.
But to your point, in terms of like quality of life for physicians, I feel like yes, a lot of physicians are getting burnt out, and I think I kind of went through that pretty early on in my career.
Okay, because you're pretty young. So.
I am, yeah, I definitely am. But this model allows us to, like I said, practice medicine in a way where we can build relationships with families. Like I'm able to sit down and have a conversation and really feel like I'm making an impact in their life. And in the child's life. So I do think it overall, it's much better and I feel happier. Like I think I definitely went into medicine to help kids and help families. And the way that traditional medicine is, where I felt like it was just like a, in and out. Like, I have to be out of here in 10 minutes or else my whole schedule is going to be off. So it's more like number game in the traditional medicine, where this time it's like actually like bringing back the patient-doctor relationship. Yeah,
and I agree with 100% because we raised our children. We didn't have any issues necessarily with the pediatrician, but I know our children had, like especially our son had mental health issues, and it was like, you're trying to develop these relationships with different therapists, and anytime you changed a therapist, it was like you're starting all over again, and they had to figure out who you were and understand you, because everybody's different. And I can see how, regardless of what type of medicine it is, everybody's responding differently to different issues that happen to them. So if you see the child over a period of time, you kind of get to know the child in certain ways as well as the parent does, at least from the physical, and their health, mental health, and all these other aspects as far as how they're developing, right? Because you go through different stages, especially as a child. There's different parts of that, right? And everything's a little bit different, and to know how the child was at 2 is going to help you understand like what's going on at 4 and 5, I'm assuming, right?
Yeah, for sure. Just like their personality and overall how they, deal with certain things.
Right.
Yeah, yeah. And this, allows me to see the children kind of develop over time. And
Okay.
we do for traditional medicine, you're seeing patients, yearly, I would say. Which a lot goes on in a year for a kid, right?
Sure.
Sometimes seeing them more often than just a yearly visit would be helpful depending on the kid, and like you said, for mental health. So we, for my teenagers or preteens, we always evaluate for mental health, but we also do like quarterly check-ins with the patient to, make sure everything's going well, because you never know, things change very quickly. And just seeing the pediatrician in times of like, this is happening right now, like we need to fix it. I approach things as let's try to prevent it so we don't get to that point, So that I think is really important.
Well, I think that's a key point. I'm glad you brought that up, because I think one of the things that we miss, just the way medicine seems to be set up now, it seems to be a reactive model where it's, okay, you come in with a temperature, we're going to try to like change the temperature, right? But there might be, we don't spend a lot of time thinking about what caused it to get to that point where these things are happening. They don't seem to think a lot about that. I mean, not that they ignore it totally, obviously, but I feel like what I like about it is we're spending a lot more time saying, how can I change things to get a better, to be healthier, essentially, right? So, I mean, what kind of things tend to come up with like children, and how do you approach this as far as the preemptive side to try to get ahead of it and encourage the parents and the child to have good habits, to have good, really respond. Like if they're feeling a certain way, well, maybe here's some adjustments. I mean, how do you kind of go through that whole process with the child? Because as you point out, there's different ages, different things.
Right.
So you got the child, you got the parents. There's a lot happening here, right? I'm just trying to understand how you kind of navigate all this,
right?
With young people. I mean, I think it's challenging, right?
It is. So, for things to change with a child, things typically have to change with a family.
Right.
So, there's a lot of input from parents that needs to happen. If you want the child he's a picky eater and I want him to eat better. Okay, well, let's try to work on that, but it's going to be more of a family approach to that. So, kids are like mirrors. And their parents or caregivers are typically, their first role model. So a lot of what
I can't eat donuts and give my kids broccoli? Is that what you're trying to tell me?
Not going to work. So it's really like small changes. So I really like, depending on the situation, like let's just say the picky eating, we work with the family and then the patient and like, okay, well, let's try to do one new food and let's try to make it a little bit fun, depending on their age. Let's cut the broccoli into little trees or something like that, or get them involved in the cooking process. And so it's more of like a family dynamic. And, kids will see if families are making changes and making these small things into their daily life, they'll pick up on it and they will definitely, start implementing that too. Like even with just like working out, like, I want my child to be more physically active. Like, okay, well, let's do a family walk after dinner and see how that works out. So it's just like these little things, but family involvement is so important, which is why I think the model of DPC like allows me to get into that. Whereas in traditional medicine, like you don't have time to like talk about that stuff. It's just like, okay, well, eat your veggies and I'll see you next year.
No, I hear you.
So we don't get that time to like really make a plan for the family, where as my model, I can sit down and we make a plan and we have visits that we're, making goals and things like that.
Well, you just mentioned something I think is kind of interesting. You're in pediatric medicine, but you're talking about family medicine. In a way, because in order to encourage the child to do certain things, the family really has to kind of adopt a similar lifestyle, because otherwise it's not going to really be effective, right? You can't literally tell the child to do one thing and you do something differently. So I can see how doing things this way would actually maybe help even the parents' health
for sure.
indirectly without them actually realizing that oh, wait a minute, I guess I'm eating more vegetables because I'm trying to get my child to eat more vegetables, and
Right.
I'm actually paying more attention to my own diet because I want my child to be healthy, and I understand that I have to be a role model. And that's really kind of the key here, right? Is a part of this is teaching the parents how to be better role models and identify the needs of their child and where maybe things are kind of falling through the cracks. And that's the part a lot of us don't realize until after the fact.
Yeah.
Like, I wish I'd caught these things earlier, but you just don't know sometimes because a lot of times we just attribute it to, oh, they're just children. They're just acting up, or they're just this or just that. But that's not necessarily the case.
Yeah, no, for sure. Yeah. So I think yeah, the other thing that I'm also a lifestyle medicine doctor, which you had mentioned earlier.
Right.
So that really focuses on prevention, and it's evidence-based strategies to have healthy habits in your life.
Right.
So that can apply to both adults and for children. So I think like a lot of what I learned from that, I try to bring into my practice, and that's applicable to adults. So really it's just like eating well, physical activity, good sleep, focusing on mental well-being, and then handling stress also is another big one. So I try to incorporate those when I have visits with families too.
Wow, that sounds really awesome.
Yeah.
So with the holistic style of medicine, I mean, I think you called it lifestyle, which I think is great. I think it's really important. You mentioned a whole bunch of areas there, and one thing that I know that whenever you try to change a habit, it's kind of tough, right? So if people come in, I know that sleep is huge for children, especially, and for adults, of course, but I think even more so for children. I think most of our children don't sleep enough, and if they don't recover and sleep, then they're not mentally ready for the next day, especially when they're in school age and have to go to school and things like that.
Right.
So what kind of steps do you help to get, because where we live, especially this part of New Jersey, it's like one of these high stress, high producing adults. They want their children to do really well. Right. And it's not that that's a bad thing, but I think what's often missed is if you're not taking care of the child's physical and mental health and their habits, then long term this doesn't necessarily work out. Like in our district, the majority of children do not like going to school, which is not a good thing long term, because you want them to want to love learning, want to continue to learn, because that's kind of what we do as adults. If you want to be successful, you have to continue learning and continue growing in your area of expertise. So how do you start this process so it's not kind of overwhelming, right? I mean, that's kind of what I'm thinking. Like, there's probably a lot. You could probably, if you go through an analysis, you're like, oh, we have to do like 20 things, or and you're like, but they're not going to do 20 things, right?
No,
so you have to kind of so how do you kind of prioritize and walk them through to kind of nurture them into this process without scaring them, so to speak?
Yeah. So I mean, I definitely have to meet them where they're at.
Right.
So that being the child and then the family. And then we kind of will go through as to what is the biggest thing that we could work on. And it's not going to be like an overnight thing. This is like a process.
Right.
And we make very small changes. So like you mentioned sleep. So sleep is a big one for a lot of kids. And depending, what age they are too. But I would say most teenagers aren't getting enough sleep. And I think that screen time is really affecting sleep for a lot of teenagers. So I try to work on, let's decrease some of that screen time before bedtime.
So how do we do that? Because this is our issue too. Is like, because we talk about this a lot with students when we go to our nonprofit does this, but it's like, that's a tough one, because they'll actually rebel. They're like, oh, I need my phone with me 24/7. Otherwise, I don't know. I have no idea, but it's
it's hard.
Right, I know. I didn't say it was easy.
Right. Yeah, no, it's definitely tough. So it kind of depends. My goal for teenagers is to shut down all screen time an hour before bedtime.
Right.
Like that in an ideal world is what we
Sure.
would do. And so we just kind of slowly work to build up to that.
Okay.
And so that'll depend. Like, okay, you can have your phone in your room, but let's just like put it on like one of those, focus modes where you're not going to get alerted.
Right.
And it can just like be near you. And some, which is, some people need it. Like, it's like, they're like addicted to their phone. They need their phone.
Well, it feels
like,
weird when you don't have your phone, honestly. I mean,
yeah.
that's true nowadays.
Yeah. So we'll work on that. Or, we just like slowly back down the amount of time they're using it. It's just like really the blue light from the screen really keeps them up, and their mind is, and it's hard. And then they're going to bed and it's like, they're just scrolling, and it's, then midnight,
right.
And they have to wake up at 6 a.m. So it's really just making small little changes. I mean, cutting off and just saying, I'm going to lock up your phone really isn't a great strategy, because yes, most teenagers are going to rebel with that.
Right.
So it's really working with them. And then also making it like, okay, parents are also sometimes addicted to their phone too, and are on their screen before bedtime as well. So it's like, okay, well, how can we do this together? So like the teenager's not doing it all by himself. Like,
right.
Okay, mom and dad are also going to be with me doing this, and it's going to be hard for them too. And we can kind of do it as a family unit, which sometimes is helpful and works out much better than just having the teen like singled out.
I would agree. I know whenever like somebody goes on a diet in a family, the other people tend to benefit because it's like, this is how we're going to eat now. They go, well, we probably should have been eating this way.
Yeah.
It's like,
exactly.
You get this kind of extra benefit, but so we go ahead and we encourage them to be healthier. So you got the sleep. Now, what about like the different strategies to just stay healthier overall? Like what? I mean, I know eating is important, sleeping is important, and what other habits should they have? I know exercise is important. So how do we kind of integrate all these pieces to make sure that we are at our best? And then how do we like kind of test for that? I'm assuming you're doing some kind of tracking to see like how they're doing and stuff. So how do I know if I'm on track? I guess is probably what I'm after here. Am I healthy or am I not healthy?
Right. And I think that's going to be, individualized.
Okay.
It's not like a one approach for everybody type of thing.
Okay.
And so I think we have to, like with my model is like really like individualized plan. So for one person, it's going to be different than the other person.
Yeah.
So I think, my goal for most kids is to, make sure we're eating a good variety of food. So we're not just eating, French fries and chicken, that there is a colorful plate that they have in front of them. So trying to get on some type of plan so we could implement that. Physical activity, making sure that they're active at least, 30 minutes a day of some sort, going outside, even in the wintertime, just getting some sun.
Cold air is good for you.
Yeah.
It is.
So they're just being outside, just being active, and then sleep, getting at least 8 hours of sleep a night. Depending on their age, sometimes more. And then, having a good bedtime routine, I think is super important, especially for younger kids, and really sticking with that. And that can be a struggle for a lot of parents. So I think there's a lot that goes into it, and nobody's going to be perfect at all these things.
Oh, no.
And that's not like what I'm striving for. I'm just striving so we can find something that your family values, and how can we work on that to optimize it as best as possible so we can have these long-term habits that we can go through life with.
Yeah, and I think you just brought it up. I mean, those routines and the habits are really, I know I rely on it very heavily. When I finally get a routine or a habit down that's working for me, it's almost like you get upset if you break it because it works, even though it's kind of a little bit of a pain. But you have to do certain things every day, otherwise you're not going to feel as good long term.
Yeah.
And I think somehow getting children to realize that whatever it is, brushing your teeth, eating right, exercising, these kind of things. I know I certainly didn't think that way when I was a kid, because you just run around and do whatever, right? I'm lucky I survived childhood, much less was healthy.
Right.
So the fact that we're focusing on this, I think it's just awesome. I mean, I really think it's awesome. So what do you see, like, where we go as far as like the strategies? Like, how do you outline the strategies? Like, if I come into you, Like, how do we start this whole like process, right? I'm assuming you do some kind of analysis initially with them and have a conversation, and then and then how do you walk through and like monitor throughout the year? I know you said they can come wherever they want, but I mean, I assume there's some kind of like structure as far as they come in, they do this, we, you know, just to kind of see how things are going and the feedback from the family and stuff like that.
Right. Yeah. So initially we'll do like an intake, I guess is how you would say it. So we'd kind of go through everything. So go through all the parts of like, how are your child's eating? How are they sleeping? Developmentally, how are they doing? Emotionally, all of that, and kind of get a sense of what's happening. And then from there, we kind of go on to, well, is there something that you want to work on? Is there something that could be improved on? Or does the child's, feel like they want to work on something? And then from there, we kind of make an individualized plan for them. And then depending on what that is, then we can decide how often we're meeting or how often we need to check in, et cetera. So like I said, it's very individualized, very personalized. And I think it depends on the child as well as the parents and their willingness to, make changes.
Are there any, I don't want to call it typical, but are there any like prevalent reasons people might come to you and say, I'm having an issue, whatever, right? I mean, because obviously most people already have a pediatrician, probably, since your type of practice is relatively new. So if anybody's of any age, more than 6 years old, there's very low chance that they're going to, this type of practice. So what kind of things decided they wake up one day and go, maybe I better do another strategy. Maybe I better figure out something. Are there some things that parents see or children issues? I mean, are there any kind of common things that you see at least starting off?
I think a lot of struggles for parents, I would say definitely eating. Picky eating is a huge one.
Okay.
So that one I think a lot of parents struggle with and need a little bit more guidance to. The other thing I think is sleep routines, getting your child sleeping, and just like, making sure that bedtime isn't horrible for the parents and the child. And then, younger ages, tantrums can be a big thing that parents just need a little bit more support on. So, I mean, it could be anything, but I guess those are
that's important to know. So, I mean, if people are seeing, I guess the thing is there's some hope out there, right? So if you have a child who's not eating well, a child who's not sleeping well, and a child who maybe is throwing a lot of tantrums for one reason or another, there is some hope out there, even though you might go to your pediatrician and they're like, well, good luck, why don't you try this, and out the door they are, right?
Yeah,
so here's where you're really trying to, dig deep into how do you help them with these different habits is what I'm assuming, right?
Right, exactly.
Okay. Yeah. All right. Okay, well, now that we've really gotten the children on the path, right? So what do you see like happening next as your profession kind of develops? What do you see it expanding into? So I'm sure, I mean, you're starting off with certain things you're doing and with a child, right? But childhood is going to be challenging no matter how good your pediatrician is or your parents are or anything else. So how do you see the trend in your industry kind of filling this gap of things that parents are seeing and children are seeing, and the needs that are kind of arising as you guys learn more and more about the struggles and the challenges that children and parents are having right now?
I mean, I think this overall model is going to be super helpful for families, just as like families and parents hear more about the model. I think they're going to understand how much value it can happen from here. So I think, like you said, being a child, there's a lot of struggles and challenges that you're as a parent, you're going to face. And so with this model and creating this relationship with your pediatrician and being able to be like, hey, this is happening right now, I need some extra guidance. And just being able to get that support, I think, is huge. And yeah, I just think that right now, since it's relatively new, a lot of parents aren't aware of it.
Right.
So really getting the word out there, like there is a different way that medicine can be practiced, and really bringing back that relationship with the parent and doctor, I think is really key. Like going back to old school, like when you had a doctor that you've had for the rest of your life, and
Right.
and then
That's
like
true.
your children had the same doctor. So it's kind of going back to that old school mentality, and really, not focusing on I have to do this because insurance is telling me I have to do this. So
Right.
I definitely see it growing and being really beneficial for a lot of parents.
Well, I definitely see a trend in the holistic side of things. I mean, I know that just on our own family is that it's not that we don't, we acknowledge like traditional medicine's fine, right? But I'm like, can I do other things first?
Right.
Before you put me on a medicine or before you make me do certain procedures and whatever. I mean,
Yeah.
that's all there and that's great. But I don't think the system's set up that way, right? Like if I have a certain profession or certain specialty, it's kind of like, if I'm a hammer, you're a nail, right? Pretty much kind of deal. But
Right.
but our especially medicine, it's much more complicated than that. And I think especially when you start integrating physical, mental health, and situational, social activity, just all this stuff fitting together.
Yeah.
There may be other strategies. So do you get into like how, if somebody comes in and you say, well, here's a diagnosis. I mean, we have an issue, right? Whatever it might be. So are you walking through kind of like all the strategies that might be out there, not just, kind of there's like this narrow ones that I sometimes feel like I get when I go to a traditional doctor?
Yeah. So, I mean, we have more time to explore different things. My approach as a pediatrician, I mean, I definitely do a lot of conservative things before, we jump into medications. Medications are great, but
Yeah.
I think that we could try tweaking a couple of things before jumping into that. So, and it's not that, in traditional medicine, we just don't have that time. So it's
Right.
like, we know this works, so I'm going to just give you this medication, which is fine. But I think like in my model, we just have a little bit more time to spend with families and really like dive into other things versus just throwing a medication at them.
And again, I'm not against medicine. Don't get me wrong here, but it's kind of like the thing I've noticed is like when you start with something, it's almost like there's some kind of side effect to something, and then then you're adding something else to handle the side effect.
Right.
And then before you know it, you're on like 5 or 6 medicines because the side effect of this one handle the side effect of that one. And I know at least in the mental health side is like, we were actually at points with our son, we're like, okay, we got to start over because we're not even sure where we're at anymore. Because a lot of that stuff takes, weeks, if not months to like really flow in there. But especially as the child's growing, you're not really sure what's developmental anymore and what was the medicine and what was the side effect and all that kind of stuff. So I think trying to find solutions in addition to that, because as an example, I know one thing we were concerned about is it seems like a lot of people are on like anti-anxiety medicines. And anxiety is a real thing, but is it really necessary to go straight to that? Or are there other things you can do to try to lower the person's anxiety before you actually go and do something like that, right? And try to...
Yeah, definitely.
Because a lot of it's like situational, environmental, and things like that are creating these anxious things.
For sure. Yeah. Anxiety is a big one. But yeah, there are things that we could try before we need to, intervene with some type of medication. And therapy, I always recommend therapy. I think it's great. Getting started early when we're just seeing beginning signs of some anxiety can be helpful. But definitely implementing strategies is key. It just and it starts like when they're younger, of like how to manage these big emotions and how to what to do when you're frustrated, or all those things that you're teaching them as they grow up, they're going to take with them as a teenager. But definitely having coping mechanisms for anxiety is super important, and being able to see your pediatrician before it gets to a point where you need medications, I think is key. And with this model, like I am seeing the child more often, and we are doing check-ins with our teenagers, so we can see like, are there signs of anxiety that are popping up that we could maybe intervene before it gets too much. So yeah.
I think you're touching on something that's really important, which is really basic, but I think this model addresses, which is if you get used to having conversations about things about your health, then it's going to be much more natural. And that's what we find, at least with our what we deal with mental health of the kids, is like a lot of times they're kind of dealing with this on their own because they're not used to talking about it out loud with their parents or with professionals. But if you're starting them having the conversations more often and younger, on like small levels about how do you feel good, you feel bad, whether it's mental, physical, whatever it is,
Right.
you're going to pick up on things a lot sooner, which means you're going to have a better result because at least you're going to address the things that are actual issues
Yeah.
and allow the other things to kind of develop. Is that like kind of what you're saying?
Yeah, no, for sure. I think, the whole thing of just like developing relationships, that's part of it. So like, the child, and then, when you see them and you're like, okay, something seems off,
Right.
like let's try to dive into that before, things kind of get out of hand. So. Yeah.
Right. 'Cause I know we encourage parents to talk to their kids more often, and the ones that do, they'll actually voice it with you. If you start, one of our tagline is start the conversation. So if you start that conversation with your child in a non-judgmental, just, hey, and here's the part you have to be careful of. Don't respond negatively no matter what they tell you.
Yeah.
That's the hard part as a parent. If you ask them a question, you might be careful because you're probably going to get the answer, but you may not like the answer,
Right.
and you have to be careful not to be happy they had the conversation, right? Because the child is where they're at, and you can start to address it, because the key to finding out anything is you have to start by determining what the actual issue is, right?
Yeah.
And I think talking, and especially with children, that oftentimes don't really know what's happening, right? Because sometimes they'll feel like, well, that's normal. I have this pain. I've always had this pain. And until they actually talk to somebody who says, well, no, that's not, most people don't have that pain. Maybe we can do something about that. Maybe we can help you with that.
Yeah.
Right?
Yeah. So definitely having these conversations. Yeah, for sure.
Okay. So where do you think we go from here as an industry? Are we gonna keep doing this more and more? So what do you think?
I mean, I hope so. I mean, I do think it's great, and I'm happy and excited about my practice, and I think I hope to just continue to grow. And I think there is a real need for this. So I'm definitely hopeful, and it's, I think it's going to be like the future of medicine.
Okay. Because you're seeing a lot of the traditional doctors starting to come over to this. Is it fairly prevalent? Is that what's happening?
So it's a lot of new practices are starting. So a lot of physicians in traditional medicine are kind of exploring like what else is out there,
Right.
what else can be done. Because it's tough sometimes in traditional medicine, just with the amount of administrative stuff that you don't know that you're getting into. When
Yeah.
you're
I heard it's like 35 to 40% of the cost for like a doctor's office is just processing the payments and the medical and following up with the insurance company and submitting it 3 and 4 times because they keep denying the claim and all that
Right.
fun stuff.
Yeah, it's a lot.
And people don't really, on the consumer side, you just go, I mean, one of my things I say, I've commented with many people about this, like, I'll go to a traditional doctor and I'll get I'll have a whatever, visit. And then my first notice is that you're 90 days past due because I never got a notice because they were still battling with the insurance company for 3 months. And my first notice directly was that, oh, by the way, we denied that and you owe money. And I'm like, what are you talking about?
Right.
This is the first notice I've gotten. But literally you guys could battle for months. And I think some people don't realize that that's a cost, not just, from it costs from the actual office standpoint. It drains the doctor too, because they have to deal with all this stuff.
Right.
And if they're allowed to really spend more time focused on the child or whoever, then you're going to get a better result, I think, right?
Yeah, no, for sure.
Okay.
Yeah.
Well, I'm an advocate because I did it. I made the switch myself as an adult. So I
great.
appreciate what you're doing.
Thanks.
Thank you very much for coming with us today,
Thank
Doctor.
you for having me.